My name's Martin Mburu. Martin Mburu is a senior programs officer working with the Ministry of Health, Afya House, Division of Reproductive and Maternal Health. And we are glad to be in Siaya County. And the purpose of us being here in this county, we are pretesting the key messages that are targeted to young people and the community at large, which is addressing the key areas of reproductive health, including SGBV, that is the sexual and gender-based violence. It's also addressing the HIV/AIDS, and also we are addressing the key messages towards elimination of maternal and child death, that is child mortality, perinatal death and maternal mortality rates. And this is the first county that we are pretesting our messages that we started them. We started to develop these messages early 2023, that is around March. And we are targeting to pre-test in the 4 counties before we roll it out to the entire nation. That is Siaya County is the first one. Then we'll move to Mombasa, go to Garissa, and eventually in Nairobi, whereby towards the end of this year, we are looking forward to be able to finalize and also to validate these messages so that they can be used in the whole country. And these messages are specifically targeted to the duty bearers, and the duty bearers are the policy makers, both at the national and the county levels. We're also looking, these messages are targeted to the caregivers, including the healthcare providers, the guardians and the parents of young people. We're also looking these messages to the right holders, who are the young people themselves, the challenges they go through, and what kind of address they would like for them so that their issues can be addressed at all levels, from the community all the way to the highest office of the land. Thank you so much. The youth form the larger part of this country, considering that not only in Kenya, globally, but in Kenya, to be specific, we have the largest number of young people, that is between 10 to 24 years. They form around 66% of our population. Then, number 2, young people bear the biggest brunt of the adverse health outcomes of reproductive health, including they contribute to almost 50% of all new HIV infection. Number 2, issues to do with the teenage pregnancies. It is leading. Like, for example, I can say in Siaya, teenage pregnancy starts at 21%, which is quite high. And that's why specifically we are targeting young people. Because if at all we don't reach out to them, then we are looking at how we are going to lose a generation. Because if at all we don't deal with them now, then we are looking at a glimpse, a future affecting these young people. Yes, exactly. Thank you so much. Yes, once we've done this message, because right now we've been able to capture them only in English, which we normally say is the official language, English and Kiswahili. But Kenya has a diversity of languages. So we are looking at how we can be able to translate these key messages so that they can be able to reach even the utmost ends of this country, where not everybody speaks English or Kiswahili, so that it can reach them in the language they can be able to understand, and also cause them to change the way of their lives in terms of reproductive health.
My name is Gladys Kio. I work for African Gender and Media Initiative Trust as the Executive Director. We are a women's rights organization, and part of the work that we do is to advance the reproductive health and rights of girls and women. What we are doing here today is we've been on a journey since last year of doing consultations collaboratively with young women and duty bearers, specifically the Ministry of Health, the Division of Reproductive Health, and also involving counties like Siaya County, Kilifi County, Garissa County, Mombasa County, working with those duty bearers to address the issues, the reproductive health issues that are facing young women. and also adolescent girls. One of the things that you might be aware of is that we have what is being called now the triple threat: HIV, GBV, and teen pregnancy. And actually it is now going to triple threat plus, because there's also that those three issues are also coming with their own challenges with regard to mental health. So to address those challenges, we asked ourselves as an organization, and also with the partners that we are working with, what is it that we can do to improve the reproductive health outcomes among adolescent girls and young women, boys included too. That so when we asked that question, we said we need to communicate better, because we have health facilities, we have health workers, we have the young people, but we still have this negative health, reproductive health outcomes. So one of the things that we identified is the need to create awareness, the need to communicate better in the sense that the recipient of that message appreciates the situation and what we are asking for. So what we did to achieve that is the journey I've just referred to. We have been working with the national government, the Division of Reproductive Health, and the counties that I have mentioned, to develop messages that are addressing young people living with HIV, young people with disability, addressing gender-based violence across board, so, and also reproductive health, specifically issues around family planning, so that we can be able to communicate better. We want healthcare workers to appreciate the needs of adolescent girls and young women, to appreciate their reproductive health needs, so that when they visit health facilities, they are able to access what we are calling youth-friendly services. So we are building the capacities of health workers around that, alongside developing these messages. And these messages are being developed by the young women themselves and the duty bearers themselves, collaboratively bringing that young person in the room. It is important that we have young people in the room, because we cannot address them in absentia. For us to be effective, we must listen to that voice, and that voice must count. So that is what we were doing here today. Looking at the messages we've created, we've gotten very good feedback. There are messages that have been developed by different cohorts of young people. They are being corrected by cohorts of young people, so that by the end of this, in the next 4 to 6 months, we will have messages that we can use nationally, everywhere, in every part of this country, to speak to the issues that are affecting adolescent girls, young women, with regard to their reproductive health, and also, very critical, also their mental health. Yeah.
My name is Lona Nyandat. I'm the Executive Director in Women Empowerment CBO, NYECBO. So today we have partnered together with GEM Trust, Ministry of Health national level, and the Ministry of Health, Siaya County, and we've been able to have a meeting, we convened a meeting where we've been talking with the young women in their diversity and developing messages, pre-testing them. These messages are geared towards ensuring that health access among young women in their diversity is improved, and especially adolescent girls and young women. So we have noticed a gap where the health-seeking behavior of young women has not been very promising, and especially in Siaya County when it comes to issues and matters around sexual reproductive health. So we have convened today together with young women from Siaya County to look at these messages. Do they really resonate well with the issues that affect us as young women in Siaya County? Will they be messages that would encourage us as young women in Siaya County to access services? So that is what we have done today, and we're looking forward to cascading this because we are still going to have meetings in other counties like Garissa, Mombasa, and Nairobi, and after that the Ministry of Health national level will then print these messages, and these messages will be used nationally among all of us, all over the country by the young women. And these messages are geared in different platforms, that is social media, print media, and even the old media, to ensure that the Ministry of Health, and specifically those counties that I have mentioned, are able to increase the young women's health-seeking behavior when it comes to matters reproductive health.
I'm Pamela Josephine Anyango. I coordinate reproductive health services within Siaya County. and we are glad that today we were working on a validation and pre-test of SRH advocacy messages. These messages are geared towards the right holders. The right holders are the community members. The information being passed to them will be that if they need any service, they're free to get accessible services across all our health facilities. These advocacy messages also targets the policy makers, that is both the national government and the county government. What are some of these things that we must put in place to ensure that we have access to SRH messages among adolescents and young people? Then these messages also are targeting, the advocacy messages are also targeting the healthcare providers. In what ways can we provide youth-friendly services within the county to ensure that we deal with the issue of triple threat plus, that is the issues of teenage pregnancies, the issues of sexual and gender-based violence, and the cases of new HIV infection among the adolescents and young people also, taking into consideration that mental health is also an issue within the county. Yes, it was a challenge, and as we are coming up with these, the pre-tested messages now, we were with the young people. Many a times they've asked, why us without us? So we were with a group of young people and we were trying to come up with the messages, and they've actually given us a feedback on what type of services they expect to find within our facilities and how they want to be handled when they come for the services.
So, we thank you for your participation and for your question. Tukianza tunataka kuanza senye tumekubaliana order ndio nataka taking a contract now. Kesho tunafika saa ngapi? Yes. Which what you wanted? We will be on the same page. We will carry this conversation with us tomorrow. Otherwise, sina mengi. Unless
the information that you have given us, it goes a long way. I've even been the admin was discussing something with us here, and he has given us a contact of somebody who received money. Somebody I've never seen, I've never known to have worked in the hospital.
communication.